Good evening and welcome to Adult Children of Aging Parents, or ACAP. My name is Ashlyn Martin, and I, along with Bruce McReynolds, serve as co-chapter coordinators of the Adult Children of Aging Parents here in Guilford. On behalf of the ACAP Guilford County team, we would like to welcome you to tonight's presentation entitled Strategies for Preventing Falls. ACAP Guilford County programs are presented the third Thursday of each month at 7 p.m. Visit the upcoming events section of the ACAP community website at acapcommunity.org to view the presentations. I hope that you will join us for the September ACAP Guilford County program on Thursday, September 16th from 7 to 8 p.m. Our topic in September will be setting boundaries in family. If you would like to be notified of upcoming programs, you can email us at acapguilford@gmail.com to get on our mailing list. You can also take advantage of expert-led content in our podcast library found on acapcommunity.org. In order to bring our programming to you at no cost, we have some really great organizations that have stepped up to support chapter activities and programs. Our annual sponsors that make all our chapter activities possible include two core Providence Place and Griswold Home Care, as well as our chapter sponsor, Mount Zion Baptist Church. Tonight's program is Health Team Advantage. I would like to read a brief bio from Health Team Advantage. They would like to welcome you to the August meeting and they hope that you are excited to be here with us this evening. For those of you who may not know, Health Team Advantage is based in Greensboro, offers Medicare Advantage plans eligible for Medicare. Health Team Advantage has close to 16,000 members in the tribe. Medicare Advantage cover everything Medicare covers, plus lots of things it doesn't, like dental, vision, prescriptions, hearing, and fitness. The goal of Health Team Advantage is to be the leading Medicare plan dedicated to exceptional care. Their mission is to improve the health and well-being of their members our communities through a commitment to personalized quality and support. Their tagline is that they are local, reliable, and accessible. And those are the ideas that they keep in mind, not only when connecting with and serving their members, but also when connecting with the community. Thank you for letting us be a part. And if you would like more information, contact them at healthteamadvantage.com or by calling 1-866-267-4386. If you have any questions throughout tonight, we invite you to put them into the chat box at the end of the presentation. So let's jump right to our topic for tonight's program, Strategies for Preventing Falls. We have two expert speakers with us this evening. Dr. Monica is a doctor of physical therapy and owner of New Direction Rehabilitation Wellness. After graduating from Winston-Salem State University's PT7, she went straight to working with geriatric patients. Her experience includes home health, outpatient geriatric clinics, assisted independent living, memory care, and skilled nursing facilities, which helped shape her passion today, helping seniors avoid falls, strong and independent. We also have Angela McKenna with us this evening, Bachelor of Science degree from Winston-Salem State University and her Master's degree in nursing from Walden University. She has 22 years of experience. Her last 9 years have been spent overseeing community care management development with Tri and Cone Health to help seniors safely age in place. So welcome, Dr. Monica Tillett and Angela McKenna. We're delighted to have each of you with us this evening, and I'll turn it over to you to begin.
Thank you. We're excited to be here today. Both Dr. Tillett and myself are very pleased to provide you with this presentation, Preventing Falls in the Home. And I'm going to go to my slide deck now. Our objectives this afternoon. After this presentation, you should have a very good knowledge of the relationship between aging, mobility, balance, and falls. You should also be able to assess your personal and environmental risk factors for falls. And we are going to provide some tips for preventing falls in the home and in your environment or community. I'm going to turn it over to Monica to go ahead and get us started.
Thank you, Angela. As Ashlyn stated, the passion for helping our seniors stay at home safely and avoid falls is super important. So a way to kind of help people to know how important fall prevention and balance is by showing them, the effects of, falls, not only for the individual, but for the healthcare community as a whole. So if you could flip back to, thank you. So 1 in 4 adults 65 and over fall each year. That's a lot. So it's making it, the leading cause of fatal and non-fatal injuries. Every 19 minutes, an older adult could die from a fall, and that's sad and, very eye-opening at the same time, because that's a lot of falls. So by 2023, you're going to see more falls and more costs related to falls as those things progress. But just each year, more and more people are being treated. So 3 million injuries were treated in the emergency department and over 800,000 hospitalizations. So 2015 was the last study that I saw actual dollars amounts as it paid in relation to falls. But in 2015, Medicare and Medicaid, they hosted about 75% of the $50 billion spent towards fall-related injuries. That's a lot of money. And that also says that because Medicare and Medicaid paid 75% of that bill, that it is our seniors that are falling. So keeping them safe is a priority. And also, if you look at the stats for what they're expected to spend by 2030, it's going to double, so we're looking at $101 billion in fall-related injuries.
And just knowing about the cost and the injuries that are happening, we also have to look at the deaths. Because we have more and more of our older adults who are falling are ending up not being able to recover. So the projection by the CDC is that by the year 2030, looking at those same dates for the cost increase, we're going to be increasing the death rate for falls as well. So by 2030, it's estimated that we will see 7 fall deaths every hour, which is extraordinary. And it just lets us know that it's an emergency for us to go ahead and provide education and get in front of this before this happens. So we would like to start out by talking to you about the 5 top causes for falls. In order for us to be effective in preventing falls, we need to know what's actually causing them. So we have several different categories that we're going to break down for you tonight. 5 of them, actually. We're going to look at the normal changes of aging. We're going to look at illness and physical conditions. We're going to look at environmental conditions, medical side effects, and a history of falls.
Oftentimes, I hear from my clients that they feel that because they're older, that a fall is a normal part of the aging process, that, I'm getting older, so I'm automatically going to fall. But that is not true. A fall is not a normal part of the aging process. However, a decline in your eyesight, in your hearing, in the sensation in your legs and feet, those are the things that occur as you age that could put you at a higher risk for falling. It's also been found that, typically, the females start in the 65 to 84 range as it relates to fall risk, and males are 85 and over. But again, being proactive with some of the things we're going to, present to you tonight will help decrease your risk for falls in these areas.
The next slide is talking to us about illness and physical condition. As Monica just stated about age, the next step is those people that are getting sicker with chronic illnesses, they tend to have more chances of falling. People with chronic conditions such as Parkinson's disease, Alzheimer's, diabetes, arthritis, just to name a few, those are some of the conditions that we deal with, a lot of people deal with in their older ages, and they can get have problems with pain and decreased coordination, muscle weakness. All of those things kind of combine together to create a perfect environment for someone to have more access to falls, or more of a problem with falls. Another thing that we don't think about is once you've had a fall and you've been injured, you might have to have surgery, such as a hip. You might have a hip fracture and have to have a surgery for that. Well, while you're recovering, you are at a higher increase of falling. I keep going the wrong way. Sorry.
So environmental conditions, we just briefly highlighted some physical conditions that could predispose you to falls, but the environment around you can also be a cause for falls. So throw rugs is probably the number one thing that I see as I'm treating clients for balance and fall prevention, that is causing them to fall in their homes. And that is because, if their muscles are weak and they're not able to pick their feet up as high as they need to, it often gets caught on the edge of the rugs. Or if they're using a cane or walker, those items can catch on the edges of those rugs, and that's what causes the fall. Poor lighting, if you add that, decrease in vision, and then you're not having adequate lighting within the home, that's going to cause falls. And believe it or not, walking to the bathroom in the dark will cause a fall, and that happens a lot because a lot of times you don't want to get up and turn the light on. But having those night lights at night, or a flashlight, and even during the day, if the sun is not providing the adequate lighting inside the home, then making sure that you have other ways of adding that supplemental light. Clutter in the walkways is another big factor that can cause falls. So we're not talking we are talking about, papers and, books and things of that nature that are actually on the floor that you could step on, but we're also talking about furniture and other unnecessary items that may be in the living room or in the bedroom, we have for decorative purposes. So, you just sit and look, at the different rooms in your house and say, do I need 3 ottomans, or, do I need 2 coffee tables? If you have to negotiate around so many things just to get from point A to point B, then that's, you should really think about, decluttering some of that, taking out things that aren't absolutely necessary. The bathroom is another main area that we need to be really careful with. And that's because, the bathtub and shower is slippery. The floor is slippery when we're getting out of the shower. So having those non-slip mats, also, those non-skid strips can also be placed in the bottom of the shower, and having grab bars. Step ladders, reaching those hard to reach areas. Believe it or not, yes, many of my seniors that I go and see are still trying to climb on step ladders to get things that are in hard to reach areas. So getting someone maybe to put shelving down to a lower height, or maybe just putting more of those things on the counter where you don't have to worry about negotiating up and down, those ladders will help decrease your risk for falls. Floors, hardwood floors, vinyl floors, any of those hard type surfaces, if they're freshly waxed, if there's water that's spilled on the floor for some reason, or if you're incontinent and you aren't able to make it to the bathroom in time, sometimes that liquid will also cause you to fall. So just being extra careful on those really slick surfaces to make sure that there isn't any type of liquid or spill that you're going to be walking over. And then the last thing you want to really take note to are different flooring that needs repaired. So, the sidewalks, as you're walking in and out of the community, oftentimes you'll see there's chunks of that cement missing. Trying not to walk at that area. Find a different area that, isn't in need of repair, but also thinking about your home. Do you have flooring like the carpet is very frayed, or if your hardwoods or vinyl is starting, to come up, or there's largely chipped areas in those flooring, looking to get them repaired, as well as the steps that are leading into the home. Are they sturdy? Is everything in place the way that it needs to be? Because those are areas that could cause falls.
Medications is another thing that can cause you to fall. Medications for some diseases or illnesses have a high probability of causing you to have some dizziness, which could cause you to be unsteady on your feet. Medicines for diabetes and heart conditions, high blood pressure, depression, sleeping problems. All of these are put you at high risk for falling. With our elderly, there's something called a Beers list, and we use this Beers list to look at medications that put our seniors at risk. So if there are medications that are on that list, we try to go with a different medication, something that's has a less of a instance for causing these side effects. People that are taking 4 or more medications, and they have a higher risk for falls. And I know that working with my seniors in this community, I know that they are on a lot more than 4 medications. It's very rare that I see someone with 4 medications. That's very, very rare. So if we have that number of medications, we want to make sure that the doctor or your pharmacist is looking at that list to review it with the both the patient, and if you have a caregiver, then that caregiver or loved one can go along with them to help them to understand which medications that they need to be alerted of. New medications. Anytime you start a new medication, we read the side effects of a lot of the medications that we're on, and sometimes, we get the flyer and we just throw it away. It's very important to read it and understand what side effects this medication is going to have, because it can put you at a higher risk of having a fall or other things if mixed with medications that you're already taking. So always take the time to talk to your pharmacist about the medications that you're taking.
So we've talked about medications, we've talked about some physical conditions and environmental conditions that can predispose you to falls. But another item that can increase that risk is if you've had a fall within a year. So those who have had a history of a fall within 1 year, it does put them at a higher risk to have another fall. And sometimes you wonder, why is that? Just because I fell one time doesn't mean I'm going to fall another. But one, if you don't figure out what caused the fall the first time, or if you knew what caused the fall but still haven't made the changes, then that is what's going to predispose you for another fall. But then also, for our seniors who have fallen and maybe they've hurt themselves or have come very near to hurting themselves, there's a fear that develops after that fall. And the fear could be, if I fall again, I may not be able to stay at home. And so they're really tense and uptight, and just that tension itself can cause them to fall. Or, you could have pain from the last fall that you had, and that's causing your walk not to be, as steady and reciprocal as it should be. So it's the results of the previous fall that could cause an increased risk for future falls.
So now we've heard about what causes falls. Now let's learn what we can do to prevent the falls. We're going to go over, again, several different things. We're going to talk about exercise. We're going to talk about the follow-up with your provider and making your home safer.
So exercise, it keeps us strong. Yes, it can help us, decrease our risk for falls, but overall, physically, it's going to improve your brain health. It's going to reduce anxiety and depression, help you sleep better, and even help you lose some weight. If you're getting in the amount of exercise and, having a healthy diet, and all of these benefits are important because, if you're not rested, or if you are overweight, then those things are also risk factors to falling. So just getting that overall health benefit is going to help you overall when it comes to your balance. So the recommendations that is recommended by the CDC is that we get 150 minutes of moderate intensity exercise, or you can do 75 minutes of vigorous exercise per week. So, or you can mix it up, maybe do a day of moderate and a day of vigorous. But overall, just tallying up those total minutes is really what they're looking for. And I like to recommend that you don't just focus on one type of exercise, because just doing balance training is not going to improve your balance when, we need our muscles to be flexible in order for us to be in the right posture. A lot of times you'll see those slump postures, and that's because there are some tight muscles somewhere, or those patients who, when they fall, they're always falling backwards. There's some tight muscles somewhere, more than likely. And so you can do, all the balance training that you can do, but if you still have deficits in your flexibility, in your strength, and even your endurance, then it's still going to put you at risk. So just try and do a variation of activities, so that way you can, have well-rounded mobility.
Maintaining safety in your home. Monica has touched on several of these items. Some of the things that you want to do is you want to make sure that you are looking at your home or your loved one's home to make sure that each room is safe. And as Monica stated before, we're looking at removing clutter from our walkways. Sometimes we find in our elderly patients' homes that, they're collecting various things. They're collecting magazines and newspapers, and they kind of stack them in the hallway. And, you make a little path beside, the clutter that you have. Those things can actually, cause you to have a fall. One thing is one magazine with a slick cover is sticking out and you end up stepping on it. Well, that causes you to have a fall. If you have a throw rug or a scatter rug that has a lip on it that can make you trip, because as Monica stated, you don't pick up your feet as well as you used to. And so you thought you had cleared it, and the next thing you know, you've had a fall. Scatter rugs that are on slick surfaces can actually slide from underneath you. So make sure that you're removing those things. Improving the light. We talked about, adding light to your walkways when you're getting up and going to the bathroom at night. And in your hallway, you want to get up and go get a glass of water, but you don't want to turn on the lights because I don't want to wake fully up. So if you have some night lights placed strategically in these walk areas, it can help you to get from point A to point B safely. Monica mentioned grab bars and putting those things in the shower. Maintaining your handrails. A lot of people forget about those things. The handrails are on your stairs when you're coming into your home. They might also be, you might also take stairs up and down to get inside your house or on the inside of your house. And that rail, if it's in need of repair, it can actually come loose and cause you to have a fall, a very serious fall. So make sure that you are monitoring those things. And there's a checklist that we'll talk about a little bit later that you can actually look at on the CDC website. Oops.
So, use of your durable medical equipment. Those are your canes, your walkers, those types of assistive devices that patients often use to improve their stability can actually cause a fall. And that is because they're not being used properly. So when they're walking, have you seen people hold the walker up while they're walking? So that's what we're talking about. All four walker legs should be on the floor. If you have a cane, the single point needs to be on the floor throughout the whole walking process. But then also, you also need to evaluate if you're using the most appropriate device for your current functional mobility level. So If you walk very slowly, if it's hard for you to get up out of a chair, if you notice that your feet slide across the floor and you can't pick them up, then the rollator, which is the walker with 4 wheels and a seat, will probably not be the best walker for you, because it can often get away from you because you're not able to keep up with the rolling of those 4 wheels. The seat is a great asset to that walker, but if you're not able to safely use that type of walker, then it's going to put you at a higher risk for falling. Same thing with the, regular 2-wheeled walker and the cane. If you're still using a cane, but you need to upgrade to a 2-wheeled walker, then if you're not getting that support that you need from that assistive device, then it's going to make you fall.
Following up with your provider is very important. We have scheduled appointments, or they schedule an appointment with you on a regular basis. Make sure that you or your loved one is going to these appointments. So, and when you get there, you want to report any fall that you may have had. So, coming from a standing position and going to a seated position is technically considered a fall. So make sure that you are reporting this to your provider when you go in to see them. A lot of individuals that I've worked with have been embarrassed to tell their doctors about their falls, or they'll just say, well, I just sat down on the floor. But it's important to let them know, because they can look at symptoms that or the cause of why you're falling before it becomes something serious. You'll want to talk to your doctor, as I stated before, about any medications that you're taking, any side effects that these medications have, because these will help you to be safe with your medications. For instance, if you're starting on a new blood pressure medication, to sit on the side of the bed before you transition and change positions really quickly, you want to sit on the side of the bed for a few seconds before just standing up and taking off and then ending up falling. You want to make sure that you're getting your eyes checked and get your new prescription. It's not enough just to get your eyes checked on an annual basis, but you want to make sure that if your prescription has changed, that you get the proper eyewear. Annual foot exams. If you're diabetic, you might not have feeling in your feet, and that can cause you to stumble and fall, because you don't have the feeling there anymore. So you'll want to make sure that you have an annual foot exam. Just take off your shoes when you go in to see your doctor, and your doctor will, take a look at your feet. That kind of prompts them to take a look and see what's going on, if anything, with your feet.
Now we're going to get into actually what goes into maintaining the inner balance of your body. We've talked about external factors, medications, and even, just different age-related changes. But there is an actual system of balance. But first, defining balance, and Angela actually just touched on this. If you're going from a sitting to a standing position and then you're back down again, and that was not your intended movement, was to sit back down, then that is a fall, even though you're not on the floor. So if you can't maintain an upright position throughout the various activities that you have to perform on a daily basis, getting in and out of the car, in and out of the shower, or even just walking from one room to the next without being steady and slightly stumbling to the side, then you have some balance deficits. So there are 4 systems in the body that contribute to balance. The vestibular system is the actual balance system in the body, and it's located inside your ears. How we train that system is it's trained by movement. So with us standing up, sitting down, turning our head left and right, up and down, those are the types of things that keep that system moving the way that it needs to. Once our seniors have falls, you will often see that they don't want to move around as much because they think if I move around less, then I won't fall. But sitting down and decreasing that movement will make your inner balance system slow down. You will often see also that, when they're walking, they will look straight ahead. They don't want to look left or right, or if they have to, they'll stop and turn the whole body in that direction. But the lack of moving your head will cause them to fall if for some reason they're walking and something startles them and they have to turn and look in that direction. That's why you see the stumbling, because that system is now trying to catch up to your body because it's not functioning at the speed that it should be functioning. The somatosensory system is the feedback that is being sent to the brain from, our feet, from our joints, just your sensation as a whole. And it tells your brain where you are in space. It's called proprioception. So you can know if you're standing tall, you'll know if you're leaning forward or backward. If those systems are working properly, then that will help improve your balance. And as Angela mentioned earlier, those annual foot exams are so important, because if you do have decreased sensation, then you're not going to have that proper input to the brain to tell you where your feet is when you're walking. Vision is really not anything that, as a therapist, we can do for that. But as mentioned earlier, getting those annual eye exams, wearing that proper eyewear that you're supposed to, and having adequate lighting are the things that you're going to do to help the vision portion of balance, which is actually, it composes 10% of your balance. And so if you're weak, if your vestibular system isn't working correctly, and now your vision isn't good, that's a whole bunch of risk factors working together. And then musculoskeletal, and that's just your general strength, of all the muscles in your body, including your core muscles. So again, balance is a big puzzle, and every piece fits together to keep you safe. So as a therapist, I have, various balance exams that I do when I'm with the client, and it tells me what fall risk you're in. Are you at a low fall risk, moderate, high? And it allows me to see exactly what are the deficits that are causing the fall. But if you're at home, and you're starting to see these functional things that we have on the screen right now, if you're starting to have problems with any of these things, even if it's just one of them, then you're going to want to, reach out and, get an assessment for your balance. Carrying or lifting 10 pounds, that's going to be, just something slightly heavier than a gallon of milk. Could be some of the pets that you have, the dog or a cat may weigh 10 pounds. If you didn't need anything to walk with, like a cane or a walker, but now you notice that you do need to use one of those devices to help you feel steady, or if you notice that you are furniture walking, which means every time you go from one room to the next, you have to hold on to the furniture that's nearby or hold on to the wall, you definitely want to get your balance assessed. Those people who walk slower are at higher risk for falling, and they are at higher risk for hospitalization. So if you're slowing down, that's another thing to keep in your mind. In addition to it's getting harder to stand out of the chair. Maybe it takes 2 or 3 attempts, or someone has to help you, or once you get up, you're right back down again. Maybe you have stairs in your house and you no longer even attempt to go upstairs to get something from up there. Falls within the past year, the fear, and if there's anything out of your normal routine that you're just not doing anymore, maybe you're not going to the grocery store anymore, you're sending someone else for you, then just know that these are functional things that you can look at to know when you need intervention. So there are some community programs that can help improve your balance and prevent falls. The Senior Resources of Guilford, they do a great job presenting exercise classes that help seniors, stay strong and improve their balance. I teach the Better Balance class there, but they also have Tai Chi classes, and both of those have, really, really great effects on improving the strength and balance of seniors. If you're not in Guilford County and maybe you live, in Forsyth County or Alamance County, check with your local senior centers, because more than likely they are going to have resources and classes there for you to help you with your fall or prevent falls. The next one is the Otago program, and that is an evidence-based fall prevention program that really was designed to help seniors who are 80 and over, or those seniors who are really frail or moderately to severely weak. And it has been proven to decrease their fall risk by 35%. And that is huge. So you can, go to this website if you want to find a certified Otago providers near you. It is a home-based program, so we can come to your home and do it. I'm a certified Otago clinician, but definitely if you're, an active adult and you're within, those categories, then that's an excellent program to go through.
And also your local YMCA and YWCAs. Make sure that you're going to their websites and taking a look at the courses or the programs that they offer. Each community-wide MCA or YWCA offers various classes. They offer things like water aerobics, which can help with pain. Exercising in the water can decrease the friction on your joints so that you are able to move more and keep those joints flexible. Also, there are Tai Chi classes available at some YWCAs, as well as Silver Sneakers. Silver Sneakers is an exercise program that's offered at the YW and YMCAs. These programs are free for some insurance plans. So take a look at your benefits with your specific insurance plans for those that are on Medicare. I know a lot of the Medicare Advantage plans offer this as a benefit. There are enhanced fitness classes that are offered at your YWCAs. These classes are also offered virtually. So you can actually go on YouTube and take a look at some of the videos that have been done with these classes. There are a lot of chair exercises, just to keep you flexible and help you with your strength. Now, the Aging Gracefully program is a program that's offered in Guilford County. This program is a collaborative effort with Cone Health and Community Housing Solutions. The program was started as a pilot program. We were actually part of a pilot study that was being done in 4 different states across the United States. And it the program is actually called Aging Gracefully in Place. It's designed to keep seniors safe in their home so that they can stay in their home longer versus having to go to an assisted living or a skilled facility. So if what we do in this particular program is we offer a registered nurse, an occupational therapist, and then Community Housing Solutions comes in to do various modifications that are recommended by our occupational therapist. Our registered nurse and occupational therapist goes into the home, and this is a free service where they're going into the homes. The occupational therapist does up to 6 visits in a 4-month period. The registered nurse does up to 4 visits in a 4-month period. And the Community Housing Solutions technicians go into the home and complete their services in 2 to 3 visits. The program is offered only in Guilford County, but it does, because of the services, we have seen a decrease in the fear of falling. We've seen actually a 55% decrease in the fear of falling. We've seen a 69% decrease in our clients' inabilities to complete their activities of daily living, such as bathing, or, we had one patient who was actually unable to get into her bed, and she had slept in a chair for many, many years. And with the assistance of this program, she was actually able to get back into her bed for the first time. That was one of her goals. So we do work with patient-centered goals with this program, and it has been very successful. So those are some of the resource programs that you can find right here in your backyard. I wanted to go over some of the resources that are available for you out there. I talked a little bit earlier about a safety check in your home, and the CDC has come up with a program called STEADY. STEADY stands for Stop Elderly Accidents, Deaths, and Injuries. This particular program is an evidence-based program that has looked at various resources to decrease the number of falls that we're having in our community. Everyone knows, with the data that we provided you at the beginning of this talk, that this is an epidemic. This is something that is happening across the United States, and if we don't do something about it, it's going to continue to grow. So if you want resources that you can take a look at and have physically to hold in your hand, the CDC provides these resources to you, and all you have to do is go out to the CDC website. And you can print these things off. You can give them to your loved ones. The check for safety actually goes through your home step by step, and has you to look at various areas in your home that you should be monitoring for potentials for hazards for falls. There's a brochure called What Can You Do to Prevent Falls? It goes over a lot of the information that we've gone over today. And then there's a state independent brochure. And this brochure is an assessment that actually looks at where you are. And from the score that you get from this assessment, it determines if you are at a risk for fall. And I actually printed off, or I put on here, this self-assessment tool. So as you can see, it goes over several different questions, and it actually tells you why these questions are important. Like the first one is, I have fallen in the past year. And just like Monica talked about earlier, it says people who have fallen once are likely to fall again. Those are things that kind of trigger you to understand why these questions are being asked and why it would put you at a higher risk for falling. So I encourage you to go out to the CDC website, print off the brochures, and actually, take those assessments to your loved ones and perform those to give you a better understanding of where they are and hopefully to prevent a fall. Okay, now we're at a point for any questions. And I don't think we have any questions right now.
If I could ask, what are your thoughts on wearing socks and things like that around the house? Do you have any recommendations for an older adult? Is that something you should try to avoid?
That's a great question. Do you want to go, Angela, or do you?
You go right ahead, Monica. This is right in your wheelhouse.
Yeah. Well, definitely if they have carpeted flooring, then socks are fine. But if there's any type of hard wood surfaces or vinyl surfaces, just those hardwood type of floors, then wearing the socks with the non-skid little grips on the bottom are good options if they are sock wearers. But just your typical sock on those hardwood floors can be slippery. So if you're not wearing those socks with the skid mark, non-slip skids on the bottom, then wearing shoes in the house would be better.
And I will just add to that, if you're diabetic, make sure that you are wearing shoes.
Mm-hmm.
We want to decrease your risk of foot injury because you have that decreased sensation already in your feet. We want to make sure that you stay safe and are able to continue to walk. So make sure that you're wearing a skid-resistant shoe.
Dr. Tillett, I know you mentioned kind of assessments and so forth, and very often we hear of physical coming into the home as prescribed by a doctor after a hospital stay. But what would you have to say about physical therapy services that might be initiated, by the individual, and how can that play into this balance issue?
That's a great question, Bruce, because a lot of times people feel that the doctor has to be the one to initiate those types of services, when if you are going through these checklists that we went over tonight and you see that you are in these high risk factors for falls, then you most certainly can reach out. You can reach out to your doctor and let them know that, hey, I would like to get therapy, but you don't have to have a doctor's order. For instance, with my company, you can come to me directly if you want therapy, and we can get those things started. So you don't have to wait for the doctor to send the order to get therapy started.
And your services may also be covered under their Medicare. Is that correct?
Mm-hmm. That's right. So if the balance deficits that you're experiencing, if it's significantly impacting your function to do your daily activities, and it's what the insurance considers as medically necessary, then yes, it will definitely cover those therapy services. But if you're wanting services, wellness services, or that accountability coach, or just that personal trainer type of services, then those things aren't covered under insurance, because now you're just wanting to approve upon your function. It's not necessarily medically necessary or keeping you from doing what you need to do at home. You just want to better yourself, and that's at a great place to be.
And Angela, I know you're part of the Triad Health Network, but there might be also similar networks in other communities. Is that right? And how could someone tap that resource?
That's correct. I am with what's called the ACO, or the Accountable Care Organization, with Cone Health there, depending upon your community, you will probably be, your hospital is probably a part of a specific accountable care organization. And you can talk with your provider about opportunities to partner with a case management program with your, if they're involved with the ACO or with your health insurance plan.
All right. Well, we would like to thank Dr. Tillett and Angela for joining us this evening. That was excellent information. And we would also like to thank again our sponsor program, Health Team Advantage, and for their support of ACAP Guilford County. We hope that you will join us next month for Setting Boundaries and Balancing Family on September 16th from 7 p.m. And again, you can visit the ACAP community website at acapcommunity.org in order to view the presentation. Be sure to also, if you would like to join our email list so that you can stay up to date on future programming. We hope that you all have a great day, and we will look forward to speaking to everyone again next month. Thank you so much.
Thank you.
Thank you.